segment of the show today. The guest is Dr. CPoe2. The issue is mental health in the United States of America. And of course, Dr. Poe, before we so abruptly interrupted you during that end of the first segment, let's pick up where we left off dealing with violence and some of the other things that you say contribute to mental health in the United States. I think you were talking about the Satcher study before we had our break.
Right. He recognized that mental illness is a major public health concern and did a very exhaustive study. And the conclusion is that we need to give more attention to the mental health of the nation. I think that one of the major security threats to preservation of our democracy is the mental health of the nation. And I think the school shootings, going back to Columbine, Virginia Tech, and now Tucson, are just tips of the iceberg, and that we need to devote more financial resources, more human resources to doing a better job of early screening. We need to do a better job of utilizing the resources that are available to help persons feel better about themselves. We know that persons who are exposed to positive religious experience early on in their childhood and their adolescence, they make better choices, they have a higher self-esteem, they have a healthier self-esteem, and their functioning is more positive. Launer apparently didn't have much of a religious influence. At least I suspect that. I don't know that for sure, but we do know that he chose to believe that God doesn't exist. And if when a person believes that God doesn't exist, it just opens them up to all kinds of negative influences and negative forces. And so you may recall on a previous show, I indicated that we did some research down at the Metro Jail here in Nashville back in 1989 and 90, in which we evaluated 25 persons at the Metro Jail who had committed robbery, rape, murder, incest, or aggravated assault. And our goal was to find out what was in the history of these persons that may have contributed to their behavior. What we found, what stood out was many of them grew up in single-parent homes, very little contact with the father, and also there was a lack of spiritual nurture and guidance in those families. And so we need, in my field, in the field of mental health, we need to recognize that if we're going to offer people the best mental health, we've got to include spirituality. We've got to make spiritual instruction and guidance available, all right? And so I think that's a big challenge.
As a matter of fact, Dr. Poe, let's pursue that, because I think that in a real sense, there are so many people in this world today who would discount any kind of, and I think as you indicated that the individual that was involved in these shootings indicated that there was no God, that he's an atheist, and et cetera, and et cetera. But there seems to be so many folks in life who have absolutely no understanding or no belief in reference to the spirit, that there is no spirit as far as they are concerned. They act as if they don't do anything that would encourage the spirit or would indicate that they believe that they are spiritual beings. Do you find that to be true? The kind of
very, very much. Launer said that he said on one of his blogs, I guess you would call it, said, "I refuse to trust God." Okay? As I said earlier, he thought that the government was trying to control the minds of people. They were trying to control the grammar. He was very hostile towards authority. And of course, people who reject God, they basically are coming from the perspective, I want to do my own thing. I insist on having my own way. I'm not going to let anybody tell me what to do, not even God. And so that kind of belief system becomes the basis of a self-centered belief system, and that opens a person up to a whole lot of negative influence, as I said before. One thing it does is, if I have a self-centered belief system, one of the byproducts of that is despair or deep grief. And when I'm in a condition of despair or deep grief, that causes me to have a proneness to abuse drugs, to engage in sexual promiscuity, to engage in violent behavior of various kinds, criminal behavior and social behavior. So I'm convinced that Jared Lee Loudner was suffering and probably still is in a condition of despair related to his self-centered beliefs. An expression of that self-centeredness was his refusal to acknowledge the reality of God and his hostility towards authority. Very hostile towards religion, very hostile towards the government. He saw these entities as imposing upon his quote-unquote freedom to do his own thing. And so that's a major problem, is that so many people today, especially young people, are determined to have their own way, to do their own thing, and that's violence. Whenever I want to do my own thing and have my own way, and I don't want to accept the authority of another person or the authority of God for sure, then I have become violent.
And I think you've also indicated, Dr. Poe, that gang involvement and gang membership and et cetera, perhaps not all, but that could also be an indication of depression, despair, and a real problem in terms of human life.
Very much so. Gang activity, as I said, sexual promiscuity, drug and alcohol abuse, domestic violence, assault, criminal behavior. Those are various manifestations of despair. I believe that a lot of our chronic physical illnesses like high blood pressure, diabetes, coronary heart disease are oftentimes a manifestation of unresolved deep grief and unresolved despair. And I think oftentimes that that's a manifestation of a self-centered belief system.
Okay, Dr. Poe, we're getting ready for the second commercial break, and after which we'll come back, and I think we'll have about 10 minutes. And then we'll be able to look at not only some of these issues dealing with despair, but to perhaps broaden it in order to make some kind of recommendations in terms of what the country ought to do dealing with this problem. Because it was a problem the last time we talked to you, and it's a problem now, but it seems that nobody seems to be working in terms of trying to solve it. You know, you rarely hear anybody talking about reinstitutionalizing some of these individuals that they have, quote, deinstitutionalizing, et cetera. And of course, we'll be back with our audience following this very, very short commercial break.